Chapter 9 focuses on various ways we see operant conditioning used in the everyday world. I want to look specifically at some examples of how operant conditioning can be used at school, in a clinical psychological setting, and then a few very specific instances of the workplace environment. We'll start by looking at school. We know that we can use the principles of conditioning to make school more effective, to make it a place where we can challenge students at an appropriate level and help them succeed and enjoy the schooling process. I want you to take a second and think about your school experience. You might want to pause the video and take a good, 3 or 4 minutes to think about this. Can you recall a way in which conditioning was used in your school environment that helped your school experience be better, or that made your school experience worse? Take a second, pause the video, think that through. Many of you probably thought of examples likely from elementary school where there was a punishment system in place for behavioral problems. For example, the classic example that I often hear from students is a card pulling system where each student has a red, a yellow, and a green card. When you're in trouble, you have to pull your card. Once you pull all 3 cards, something bad happens. So this is an example of likely negative punishment depending on what the consequences of pulling the card is, and is very common in an elementary school setting. But there are other ways that we can use classical conditioning, specifically reinforcement, to help school be a place where students can really enjoy the learning process and prosper. As we've talked about in the past, reinforcement tends to be the best behavioral motivator, the best tool to use to change and improve behavior. 2 key ways we can use reinforcement in the school setting is through showing approval and giving attention to students. A study done in 1968 looked at a specific classroom, a teacher named Mrs. A, who often ignored good behavior, as many teachers feel that they need to do, in order to focus on treating bad behaviors, where she would threaten students who misbehaved with threats. Her classroom, prior to the beginning of this study, often had a lot of chaos in it. The researchers went in and kind of monitored the situation and picked out some of the kids that were causing the trouble. And they told her to ignore those kids when they were bad and use positive reinforcement in the form of approving comments when they behaved well. So there were 2 students that were targeted by Mrs. A to give this special attention to. Frank was a very likable boy, average intelligence. He often disrupted class. He would get up and talk to other students, that kind of disruptive behavior that I might have myself engaged in as a child in elementary school. The other kid's name was Cliff, who was a smart kid but had low interest. He would often not pay attention during lessons and ended up hitting other kids and things like that. So Frank and Cliff were only given attention by Mrs. A when they behaved well. Maybe Frank sat through an entire story reading session. Cliff made it through a lesson without hitting another kid. Each time these kinds of activities or behaviors happen, Mrs. A would say, "Great job, I'm really proud of you, you did really well." But she would ignore the negative behavior. At first it was really hard. Okay, she had a hard time, first of all, finding things to reinforce because, again, these students were troublemakers. They probably did not behave appropriately often. But over time, she started being able to identify those behaviors and using this reinforcement. Prior to conditioning, both boys were misbehaving about 50% of the time, and through this intervention, she was able to decrease their misbehavior to around 20% of the time. And as conditioning went on, that level continued to drop. So this was a very effective way to target those negative behaviors in her classroom. You can think about ways you can use the same approach in other environments, even at work. If you have coworkers who are causing problems, you can think about how you might use this in your own home with behavioral problems with children, and even in friendships. If you have a friend who's engaging in some behaviors you wish they wouldn't. That same approach can help us in a lot of different contexts. When you have the chance, I want you to take a look at Skinner's teaching machine. This video has another great example of how we can use the principles of operant conditioning in the school environment. Basically, what happened is B.F. Skinner came up with these almost computers that provided students with reinforcement for correctly completing problems. And you can see the same kind of effect on their learning, in this case instead of bad behavior, as we did in the situation with Mrs. A. So make sure you take a minute to watch that video. Next, we want to look at some clinical applications of operant conditioning. This is another point where I want you to take a minute to pause the video and think through this question. How would you approach, if you were a therapist, a client who came to see you with the following problems? Addiction, phobias, marital problems, self-injurious behaviors, delusions. Pause the video, consider that for a minute, and continue the video when you're ready. These are actually all areas of psychology where we can use operant conditioning to help decrease the sources of stress in a client's life. To start, I want to look at self-injurious behavior. This tends to be very common among children with developmental disorders, such as autism spectrum disorder, and usually takes the form of things like banging your head on the table, poking yourself in the eye, chewing on own flesh. Those are in more extreme cases. Clinicians used to think that this type of behavior was involuntary, meaning that the children did it without really meaning to. If that were the case, there wouldn't really be a great conditioning-based intervention. So they treated that with restraint holds. While restraint holds can stop self-injurious behavior and may sometimes be necessary to protect a child, they have a lot of negatives associated with them. They can accidentally hurt the child. A lot of parents and people in the field view them as inappropriate. So what research tried to do was come up with a way we can target these self-injurious behaviors that focus on why the children are doing them or what's causing the child to do them. So, drawing on the principle of differential reinforcement of incompatible behavior, researchers did an experiment where they would give an 8-year-old boy who tended to hit himself in the face a ball. After playing with the ball, after the child played for the ball for a period of time, he would receive an award, something like candy, something like that. Because of that reinforcement of the ball playing, he often played with the ball, which prevented him from hitting himself because you can't simultaneously play with the ball and hit yourself in the face. So we can use that reinforcement of incompatible behavior to help decrease the occurrence of self-injury in this population. It actually decreased the rate of this boy's behavior by 90% in just a 40-minute trial period. If continued over time, it will likely continue to decrease that occurrence. The key here, you cannot hit yourself in the head when you're busy playing with a ball. Next, we want to look at delusions. I want to quickly give you a definition. A delusion is a false belief, something along the lines of everyone's out to get me or there's little green men inside my stomach. Delusions are often associated with schizophrenia and other psychological disorders like that. Delusions are not hallucinations. They're not actually stimuli, that perception of stimuli like seeing something, but rather a belief you hold that you feel very strongly with no, real evidence or something out of the normal. Delusions also occur in Alzheimer's populations, so it can be a very difficult aspect of these disorders to treat. You can think about how delusions like this would cause a lot of stress and disruption to a person suffering from one of these disorders. So here's a quick example. We have a patient that has the delusion that her head's falling off. She, during the course of her time at a mental hospital, has positive interactions that she enjoys. She notices that when she interacts positively with the hospital staff, they respond to her positively. But she also noticed that they would respond this way when she would express her delusion. So if she told one of them, hey, I think my head's falling off, this is a silly example, hey, I think my head's falling off, they would respond with concern, with attention. I say this is silly, it definitely could happen. The staff actually noticed that she would she had begun to talk about this delusion to them more often, and that it seemed to be increasing the intensity of her delusion. So she was doing it in part, not completely, but in part because she was being reinforced for it. The staff noticed that and taught her how to interact with them in a positive way that didn't involve that delusion. So she was able to get that positive reinforcement from her environment without having to bring up or kind of ruminate on that delusion that she had. That actually reduced the occurrence of the delusion for her. Another example, a man with schizophrenia believes a witch is following him. His therapist asked him to keep a journal every time he felt that way, so he'd journal about it and track how strongly he felt the witch was following him. In therapy, the therapist would actually challenge the logic behind that, and over time, the delusion would lessen. So you can see the same type of operant conditioning taking place here. I do want to mention that delusions, when it comes to disorders like schizophrenia and Alzheimer's, are a product of a disordered brain, okay? They are not a product of the environment. However, we know that parts of the environment can reinforce the delusions, make them worse, make them more stressful for the person who's suffering from them. So we can use operant conditioning to try to lessen how extreme that experience is. But again, no one is going to be caused to have a delusion by their environment. The last topic we want to look at is a couple of, you'll see, very specific domains in which we can use operant conditioning or see it used in a workplace environment. Interestingly enough, we know that we can use these approaches, like I mentioned when talking about the school example, to improve the work of employees without adding additional costs. So I want you to take a second and take the perspective of maybe a business owner. You have a production company, you produce a product. You want your employees to maximize their efficiency, maximize their production, but you don't necessarily want to take on any additional costs. How can we solve that problem? What do you think can make someone work harder without having to pay them more? One thing we know is that feedback can help. Feedback can take the form of either a reinforcement, positive reinforcement, or a positive punishment. For example, good job, you did a great job with that. That's positive reinforcement. And that kind of positive reinforcement can actually motivate employees to work harder. It can be as simple as that. Consequences can also be used. And again, consequence in this situation does not necessarily mean something bad, but rather the outcome of a behavior. So we can use positive reinforcement, such as a bonus based off performance, where we actually do pay the person more. But because their productivity increases, the business owner actually ends up saving money. So we can kind of put a little bit more cost into the production, into our employees as positive reinforcement, help them become more efficient, which in the long term can save us more money, more bang for your buck. The last example I want to give you is taken from a zoo, actually, where we had a veterinary care giver, you can see in this picture here, who had to basically clean elephants' feet, give the elephant a pedicure. To do that, because elephants are very scary and big, and you don't want to get hurt by one, they can also be aggressive, the vet had to actually figure out how to get him to put his foot in a hole, again going back to the picture, so she could perform her job without putting herself at risk. How do you get the elephant to learn to put their foot in a small hole? You use shaping. She would make a clicking sound that would indicate that the elephant was going to be given a carrot every time he got closer to that gate with the hole. Eventually, he got over there. Then his leg would get closer and closer to the hole, and eventually through that reinforcement, that shaping of the behavior, the elephant would learn to put their foot in that hole and stay there so that the vet could care for their feet. Again, I know this is a very specific example, but I want you to take a second and think about how you could use these same principles to solve problems that might occur in your own workplace or your own home environment? How can you use these principles for your behavioral modification project? There's a lot of behaviors that we might not necessarily think can be impacted by conditioning that we can apply these principles to in a way that helps us go a lot further with our desired behavioral change.